Hey, good evening, everyone. Welcome to tonight's meeting of the Health and Social Care Scrutiny Review Group. Just to, for those of you who are not aware of the procedures, this meeting will be live streamed to the public, and a recording of the public part of the meeting will be available on the Council's website within 24 hours. If there are any remote participants, please use the hands up icon if you would like to speak. Anyone in the room, if you wish to speak, turn your microphone on when speaking and off when finished. Usual thing about mobile phones, either switch off or have on silent. Okay. Apologies for absence.
Apologies from Councillor Latif and Councillor Fatima Begum, who's being subbed by Councillor M. Hussain.
Thank you.
Chair. Sorry, Councillor Isles, she's running late.
Okay. Minutes of the last meeting, 9th of January 2025. Are those a fair and true record of the proceedings of that meeting? Thank you. Any disclosures of interest?
None, Chair.
Urgent business?
Again, none, Chair.
References from committees or other bodies?
None, Chair.
Okay. Item 6, Chair's update. I have nothing to report on, which looks like we can now go on to item 7. The report on the East London NHS Foundation Trust and Mind BLMK Recovery Lounge Service. Okay, if you could introduce yourselves and then go ahead.
Good evening. I'm Michelle Bradley, Director for Health and Mental Health Services in Beds and Luton.
I'm Alina Baker-Glenn. I'm Clinical Director for Crisis Pathway Services across Bedfordshire and Luton.
Okay. Thank you. If you want to start.
Reviewed the Crisis Cafe model. They were set up in 2020, so just before COVID, and that was a joint offer between ELFT and Mind to provide sort of free drop-in support for patients in the community. And there were 3 staff members available at each site, and there were 3 sites available each evening between 5 and 11, and that offered sort of one-to-one support. We found that there was about 1 or 2 patients attending those sites each evening. And since then, there's been further development of 24-hour-a-day mental health services. So our mental health crisis line and our crisis teams have also become 24/7. So we were due to sort of review that model, involving our sort of service users and communities around that review. We gathered service user feedback, and the users of the cafes were saying that they really valued that one-to-one support and found it sort of helpful to be able to sort of drop in. But they'd also recognised that the name kind of Crisis Cafe wasn't really the model they were looking for. They wanted that really sort of preventative approach to their mental health as well. We did a deep dive into the data, sort of looking at people that were using the crisis cafes, and about half of them were either open to mental health services or had been before, and the other half were people that weren't known to the service who found that beneficial in terms of managing their mental health. For the Luton population, and the sort of deep dive month that we looked at in July, there were about 57 users to the Crisis Cafe service. There was a workshop that we put together in November involving service users from Mind and also with ELFT to look at that model. And we had an opportunity to work in closer partnership with other community assets, such as the Beacon and Lighthouse. So there was a change in that model to be able to offer one cafe throughout the area and changing the name to Recovery Lounge. So that was a name that was picked by the service users themselves to show that sort of benefit around more community integration and that preventative approach. So that model was then implemented in December, and it'll be subject to the sort of 6-month review. It does still ensure that one-to-one support continues with our Mind staff and that people are able to access it. So it's still available 7 days a week across the county, but the sites do rotate round. So the Luton offer is available on the Wednesday and Saturday each week. When we were sort of reviewing the model, we had to sort of move at pace really because of some of the sensitivity and contracts and staff jobs being at risk as part of that. So we sort of implemented things throughout November with the service user engagement. I believe a briefing paper was sent around sort of the beginning of December, end of November time, and we do realise we should have been able to come to this committee before the implementation. So we do apologise for that and have taken that on board.
Okay, is that everything? Okay, thank you for coming here tonight. And yeah, appreciate the apology for not you're not bringing the report before the when it was a proposal rather than at the moment now, since the scheme's been in action for several months, because this is an important part of the mental health pathway, and it's certainly right that this committee should have the opportunity to scrutinise that, scrutinise the proposed change. So yeah, thank you for that. Okay, I'll throw this open. Does anyone have any questions or comments?
Yeah, can I ask you, in terms of people utilizing your service, are they sort of recommended by something, or people can just walk in and access the service? Is that it? And the second part of that question would be, it's underutilized. What is the reasoning for that? Even though every evidence we see, particularly among the young people, it is a quite serious thing since the COVID. So why is it underutilized and not being,
Yeah, it's a walk-in service. It was a complete open door drop-in service for people just coming in, and people did just come in, no appointment required, but not to the level that we had hoped. I think people are very used to how they access their crisis support, and we were obviously trying to change that for people. So, but it was open access.
In terms of why it wasn't utilised, we've sort of tried to sort of ask people, the people that do use it find it beneficial, but there's other groups, and I think given that it was developed at a similar time to a lot of the sort of 24-hour crisis services with the kind of crisis line, crisis teams available 24 hours a day who would then be able to, sort of visit people at home in crisis, then people were sort of accessing support from there as well. And sometimes we would access both services at the same time, so they would have that drop-in support as well, but we're finding that the numbers weren't what we'd hoped that they would have been, and that's why we're sort of looking at more integration with other services. So the Beacon and Lighthouse have got quite high numbers, for example, dropping in there, but they don't have that one-to-one offer that Mind are able to offer. So really trying to integrate that offer and see what advantage that would give to our service users as well.
Can I just add, in terms of people who go to A&E, so one of the things we're really wanting to do is support people with mental health needs away from going to A&E unless they need to go there. And about 50% of people who go to A&E with mental health problems aren't known to our services. So we're doing some work with primary care at the moment to really understand that, because we've had really significant comms campaigns out, and going out and talking to people to really get people to come and use the services. And I think sometimes it's, people need support just to come through a door. It's quite hard to come through a door, I think, in terms of services. So we're looking at all of those things. And of course, we're looking at, by the rotation in terms of location, does that impact in any way in terms of our other system partners? Are more people going to A&E because they don't want to travel somewhere else? So we are monitoring all of that as part of the review.
The reason I'm asking you, because what the statistical evidence is that one in 4 people will have some sort of mental health crisis. So that's quite a large number, and I'm very surprised that the access, to utilization is not as good as it should be. So is it other agencies not referring people, particularly from the primary care side of it, or people finish up in the hospital and the hospital has got, other than, they can't even give the emergency services, where you sit there for almost 17 to 20 hours before you're seen by anybody. So that's what I'm a bit surprised that it is underutilization, and something needs to be, either we're not the community is not well advertised, and that this service exists, and it is, because I know I'm a fit because of my previous role. I know it was in Dumfries Street. I visited that. It was when it was first set up. I was one of the people who went and visited and spent a few hours there. So it's only a very small number of people that know where in Dumfries Street is. Otherwise, I think we need to do more to advertise, to get the community know in Luton that there is something that they can use between 5 and 11. That's what I think my surprise is, because it was utilized very well in the beginning when it first opened.
Do you want to come back on that? I think that's an important point about utilisation. If you look at, Luton Borough Council's mental health strategy, it talks about the ethnicity of people using the Luton Crisis Cafe not matching the diversity of the population, and implying that there is a big group of people who might want to access these services who aren't accessing these services. So is it does it matter whether it's a crisis cafe or a recovery lounge if these people aren't aware of the services, and what do we do to get that awareness out there?
I mean, in terms of it being a crisis cafe, one of the things that we learned was that the title of that was putting people off. They didn't know when they could come and when they couldn't come. So that was very much marked as one of the reasons people weren't coming, which is why we did a review around that. Equally, there was issues around what support people received when they were there, and what people wanted was to be able to come at every point, which is why we feel the lounge is a different offer, because it's preventative right through to crisis. We did do a lot of promotion around the service and for many years, and tried to build it into crisis pathways to encourage people to attend, and did work within different communities. But the feedback was really about the title. And we've seen numbers rise since it's become Recovery Lounge already. And it seems to be a more welcoming offer for people, and is reaching out, and seems to be something people prefer to attend.
Councillor Chowdhury.
Thank you, Chair. I think Councillor Hussain has already touched on what I was going to ask. I wanted to understand what is different about this offering compared to the existing Mind offering that's available. And the other thing was around the sort of cultural language support, because I do know, working in Luton, having lived in Luton, I mean, with the makeup of Luton as well, I mean, a lot of people, due to cultural language barriers, do not access services, vital services like these. And is anything specifically being done more to engage with that sort of community? Do we have people there who, as therapists or recovery workers there, who do speak the languages, who are culturally aware of the communities that they serve? That was all.
In terms of in terms of the offer, your first question was, sorry, what was it?
Just wanted to know, yeah, what's different about the general mind services?
Apologies. So Mind BLMK have offers in the day, which are funded in a different way and have and different outcomes associated with them. This is still a Mind BLMK offer. The recovery lounge is funded by the Mental Health Trust, and this is 5 till 11 p.m. So it's a different type of offer to support people at a different time of day when other services are not as available. So that's, and in terms of the cultural aspect, it's something we obviously endeavour to do. Working in Luton, all our team is trained around cultural awareness. Obviously, with 3 staff in the service, we can't always get it right around language and cultures, but we do that through training and linking in with other services to try and support that need.
Just to add as well, ELFT is going through the Patient Care and Race Equality Framework, which looks at things like cultural awareness training for all of our staff, including our voluntary sector partners, as well as like our clinical teams. And it looks at how we can actually support and better engage different communities within the Borough of Luton and Bedfordshire as well.
Can I just come back? It's just an observation. I mean, from talking to people generally, it seems that when people do access any sort of therapy, etc., when they have a barrier like a language barrier, it's very hard to get themselves understood in terms of making, in terms of what concerns them. I mean, it doesn't come across quite right through an interpreter or third party. So we should really, in my opinion, we should really try and see if we can get someone who understands and speaks the language, because then there's a better sort of understanding of the issues. Other than yes, we all do training in sort of cultural awareness, etc., but it's not the same as being able to understand the person, what they're trying to say and what their issues are.
And I think that's a really key part of the Patient Care and Race Equality Framework. It's really looking at the staff that we've got within our teams, and actually whether it's working with volunteer staff, actually looking at the staff really representing the diversity and makeup of the people that the area where people live, and really trying to make sure that actually it's not just about the training, but actually is that level of cultural connection with people that really makes the outcomes more meaningful for them. So that's definitely a key part of PCREF, and working with our trust and working with Mind and all the voluntary sectors to really embed that within our systems.
Thank you.
Thank you. Councillor Ambia.
Thank you, Chair. I have one question. Have you managed to work with PCN groups? Because there are 5 or 6 PCN groups active in the Luton who look after all the surgeries. And I found some of the PCN group are very active, and they do different events and a different surgery, or with the patient participation. This is the way maybe you can reach out more people who need some sort of mental health assistance. Or is there anything you can look to install any signpost in the GP surgery if somebody call for GP appointment, and if receptionists are aware of, they can direct it to the next appointment or available dates for the for the counselings.
Yeah, I think as Caroline and Michelle, as Caroline and Michelle said earlier, I think the communication campaign that we put on was quite substantive and comprehensive, and we did sort of go into the GP surgeries. We had the information on the display boards in a lot of the GP surgeries across Luton and Bedfordshire as well. But I think, with this change, we have to, of course, continue to do that promotion to really get the information out there in terms of what that changes and how people can access the services going forward. So we will definitely continue to do that.
Okay, Councillor Mead.
It seems to me that one of the key issues here is reaching your target audience, as it were, your clients. And I just wondered, do you need to have another harder look at exactly how you are trying to reach them? I don't know, what methods do you use? Are you handing out flyers? Are you, if you put posters up in the local community notice board, I don't think you're going to get much of a response. You need a bit more direct, proactive approach. I don't know what your thoughts on that. Are you happy with the way you're finding your clients, or is there a bit of a gap there which needs plugging somehow?
Thank you. I think working closely with Mind, we certainly acknowledge that we weren't quite getting the message out in a total way that we probably would want to. So in terms of our methods that we have tried, so like I said about the GP surgeries and having the information there, also working closely with GPs about people being signposted should they present needing mental health support. I know Mind also did send out information through the Luton publications that most people have access to that goes to their homes. So I think we have tried several different methods, but I think there is something more for us to, as you say, go back and think about with this new model, how we really try to do that further in reach. Add anything, Caroline?
We also, Mind put a worker into ELF's 111 option 2 service. So when people rang 111 option 2, they could also get a Mind worker, and we use that really to divert people to the crisis cafes, and we did see numbers increase in that, but still not to the level hoped for. And also what is happening in Luton is a mental health alliance has been formed, which is funded through ELF, so that the voluntary sector who work with people with mental health needs across the town come together and support each other to promote services. So that was happening as well. And I do know a lot of people were putting the crisis cafe in the care plans for the people they worked with across the voluntary sector. And I think this is a service where people knew it was there, and being there was really helpful to them as a safety net, but didn't always access it.
Do you engage with the sixth form college, the Barnfield and places like that, where you've got young people, but on the edge of maybe some of them going into drugs, alcohol and stuff like that? Have you got a presence there? Do they know who you are?
Absolutely, and actually we were in talks to have the cafe running from the site for 2 days a week, but unfortunately we didn't. That didn't get secured, and it was for that reason, so that we could, support a wider population and be more visible as well.
With some of the work we've done across multiple agencies with Right Care, Right Person as well, we put together a service directory of all of the sort of mental health support. So the recovery lounges are a key part of that, as well as our mental health crisis line and our crisis teams. So that's been sent around all of the kind of key people, and they're also encouraged to advertise that. People accessing, for example, our mental health crisis line, our psychiatric liaison service, so at the acute hospitals, plus our crisis teams will also signpost people to the sort of recovery lounges after that as part of the safety plan. So if someone does attend the acute hospital, then even if they didn't know about the cafe at that point, for their next sort of time that they're struggling with their mental health, then they would have that point to signpost there. And we'd certainly seen people when we were looking at the deep dive who had maybe attended accident and emergency, but then actually the next time that they were struggling with their mental health, used the crisis cafe instead of going to A&E at that point. So that will be part of the ongoing monitoring communication. So yeah, any support and obviously promoting the service would be gratefully received as well.
Yeah, Councillor Hussain.
While you're talking about one of the problems we do have, and it is very much, is that there we put people with a mental health problem in the sheltered accommodation. They are making other people's life quite miserable. I know that because some of my constituents, there is 4 sheltered accommodation, and when there is a person with a mental health problem goes into there, they're predominantly very vulnerable elderly people in these sheltered accommodation. And I think it needs to be very much advertised in those places that when they are having a particular problem, that there is somewhere else to send them or for them to go in those, because the difficulties care in the community what was started many years ago has failed very miserably unless it's supervised and monitored and somebody does that. So I think that is something that you need to take into account. And I think Jill is here, that this is something that we're trying to accommodate them within the community, but then they are making life very difficult for the other residents who are living there, who want to have a bit of peace, whereas they have their own mental health problem and the crisis. So they ought to be advertised so that they can access those, where there are particularly sheltered accommodations.
Okay, thank you. Does no one else has anything more? Got a few questions just to follow on from the general thread of questioning so far about getting into the communities and making people aware of the service. So I think you've probably, in your answers, answered most of the question I'm going to ask. In paragraphs 22 and 23, we're talking about the service is now integrated into the community pathway, and it is also embedded with ELF's community services. I think you started to talk about this, like we talk about the Mental Health Alliance, and in your answers to other members. So could you perhaps talk a bit more about, what does integrated into the community pathway mean, or embedded with ELF's community services? What can you flesh out those phrases?
So we had another sort of drop-in offer within ELF services. So that was to the Beacon and the Lighthouse, which is part of the Recovery College model. And there was quite high numbers attending, but it was a very different model and a different offer. And a lot of people there would be accessing sort of ELF services. So the advantage of this model would be that Mind are then working closely with that group and able to offer that one-to-one support that had been that gap there. And it would also reach a sort of wider group potentially to allow that drop-in offer. And there are clients where they've maybe struggled to attend the groups because it's quite anxiety provoking to be able to access that group. So what we've started to find is that people are accessing the one-to-one support with Mind to enable them to then attend and access that group offer, which then might be helpful in terms of that longer term support to meet their needs. So that's part of that sort of evaluation we're looking at, is how that can work together to support people in the recovery around that. So it's really that joint offer. We know that from our community mental health team, they've been working more closely with voluntary sector, so with Mind and other voluntary sector agencies in partnership, which has been really beneficial for people with a wide range of mental health problems. So trying to offer that in the evening is hopefully also going to be beneficial for people.
If I just come in, Chair, I think one of the things that Caroline touched on is about Crisis Cafe, and actually people are thinking, is my crisis bad enough for me to walk through the door and get that service? So actually, from the recovery lounges, what we really are wanting to test out in this model is sort of community safe space for people with mental health needs. So actually, you can come here and you may have a crisis, but you can't come here and you could find friends or be signposted to our recovery college off and those other things to do. So really think about this developing into a space that really provides support in the community at place. And so the two areas that Elena is talking about, one is in Central Beds and one is Bedford Borough, but actually that's the gap for Luton. I think that would be our opportunity. So we're really testing that out now, and that's I think it'd be great to see what patients say about their experience of accessing those pathways now compared to when they've accessed crisis cafes, and actually how can we grow that in terms of the community, because actually the isolation of people, and I think you touched on it in terms of accommodation, but actually the isolation that many of the people with mental health needs experience, and actually how do we really address those sorts of things which are really upstream and stop me getting into a crisis. So that's how we're wanting to think about how this work could evolve.
Yeah, I think so. I'm starting to get there to understand what's going on. But this, for example, when we were talking about Central Beds and Bedford, but in Luton, I'm not sure what the difference is between the service now and what it was as a crisis cafe? Because it's the same building, isn't it? So how is the community going to get? How do you integrate? In that scenario where you're using the same building, presumably the same staff, how is that integrated with the community part?
Well, we're talking about the service in a different way, which has been talked about in terms of, you can come at the point of prevention through to crisis, so that kind of is making the door more open to people. Thinking about what Michelle said there about people didn't think it was relevant to them, even though actually if it's your crisis, that's fine by us. But this does seem to have opened the door. I think, that's definitely a big difference. And one of the things was challenging, I guess, was when people come in crisis to the crisis team particularly, obviously you're dealing with those particular needs, and being able to signpost across the crisis cafe is sometimes challenging because you're thinking about that person at the time. But actually now we're linking much more with the community mental health teams, so seeing it, and people are seeing it as a pathway they can build into people's care plans and think about the support people can gain out of hours from the people who have been supported in that way. We also have 2 workers who sit within the community mental health team who are community connectors, and they're doing a fantastic job at promoting this new offer to the people they work with in the community. And it just seems to be something people are seeing more as supportive to them rather than the original crisis cafe.
Okay, thank you. Councillor Chowdhury?
Just one last thing. On point number 25, you do talk about an ongoing evaluation, and I'm assuming after 6 months you'll do your evaluation. Would it be possible for you to share that evaluation with the breakdown in terms of who's accessing the services as well from Luton? Because it'd be good to see if all sort of sectors of our communities are accessing the services, and if not, is there anything more that we can do in terms of helping to make sure that people are aware and are accessing the services? Is that okay?
Yes, absolutely. We'll do that. Thank you.
Okay, thank you. I've got a few more questions, I think, just to tidy up, I guess. So this the change from crisis cafe to recovery lounge. I mean that in Milton Keynes they still have a crisis cafe that's open 24/7, 365 days a year. So what is the difference between what's going on in Milton Keynes and the rest of BLM? Okay.
The Crisis Cafe in Milton Keynes has always been a much more successful offer over there. We work across Bedfordshire, Luton and Milton Keynes as a Mind, and we do find that each area is very different in terms of how people access services. It's been really hard to kind of pinpoint why. We are in a building in Milton Keynes, which is used by the Mental Health Trust. It's known as a building. The Recovery College there is based there, and a number of other voluntary sector organisations. It's very accessible in Bletchley. We've kind of tried to drill down on this. It seems to be really in the pathway as well. And also we have workers, Mind workers every evening in A&E. So we divert people there, and we've also got people who work in 111 option 2. So again, we're able to divert people to the service, but that sees about 7 people a night. So,
Chair, if I could just add that actually for Milton Keynes, the crisis cafe offer was probably the strongest crisis pathway offer, and 111 came later, and 24 hours, 7 days a week crisis team, whereas in our neck of the woods it was actually we had those other services first, and then this was an add-on. That was really the core part of the crisis offer, so I think everybody had to really use that as the first offer, and then these other things have grown behind it.
Okay, so in Milton Keynes service users don't mind the phrase crisis cafe, then they don't mind the word crisis, where in the rest of BLMK there is I don't know, it's almost like a stigma attached to the word crisis.
I think the national model from NHSE was around crisis cafes, and that was the name from there. But there's quite a few areas that have actually changed. So Hertfordshire, for example, have changed the name, and a lot of people are asking the service users, what would it mean to you and what would you want from it? And there's similar, I think it's the label kind of crisis in terms of people really struggling to access that. So that does seem to be a common problem in other areas where they have tried to adapt the name or change it or look at how they're sort of communicating that.
Okay, thank you. If there's nothing else, I think. Oh, sorry, Councillor.
Thank you, Chair. On point number 18, you have mentioned about on the second sentence, lack of opportunity to support integration with other community, right? And I can see on your the availability and location, and it's mostly on the 2 days you run in the Luton, and both are on town center. And on the 18, you mentioned about local community. Have you looked to relocate your surgery other part of Luton in order to reach other community, like 1 day, like instead of 2 days same place, you can have a different day, different part of the town where you can reach more BME community like Berry Park or Dallow and other community center. They're renting. Thank you.
Yeah, we have considered relocating quite seriously, and we've had a lot of feedback around that. It's been, challenging to find the right location. Any help with that would be happily received, but we do feel that would be helpful.
Yeah, thank you.
Okay then, if I can just wrap up. Thanks for coming here tonight and presenting the report. I think you mentioned, Councillor Chowdhury mentioned the evaluation in 6 months' time. Yeah, that would be appreciated if you could come back to this committee when that work is complete. I think as well as the details about the evaluation, I think what I would appreciate is a similar report to this, but fleshed out a bit with more details about. It's probably a bit late for including the reasons for the change and how the change fits in with the mental health strategy. But it would be good to have more information in the report about how the new service fits in with the community pathways, how it is embedded within communities. And I think I would like to see a lot more information on user feedback. I mean, presumably that's going to be part of the evaluation. If that's okay, that would be appreciated.
So absolutely, Chair. So just to be clear, just to bring that to the evaluation paper, that add on that narrative that you've just requested, yeah? Yeah, absolutely, that's fine. Thank you.
Thank you very much. Thank you. Okay, thanks very much. Okay, so we'll move on to the final item tonight, the draft work programme. So it would appear that the agenda for the 15th meeting on the 15th of April should be as is presented there in the report. So I think that's looking okay. And we are scheduling a meeting with Director of Public Health and the Public Health Service Directors to arrange the rest of the work programme for 2025. So if anyone has any questions about the work programme. Chowdhury?
Something I came across recently, and I'm not sure if it's worth sort of asking BLMK or ELF to come and make a report. I'm with the Kingsway and Birmingham PPG, and ELF's contract's coming to an end, and there's BLMK are looking for a new provider. So maybe in sort of update, because I mean, patients are really sort of left in the unknown, not knowing what's going to happen. I know service-wise, everyone's being told there's going to be no change, but in terms of staff, etc., at both the surgeries, I mean, it's quite a sort of worrying time for them. The other thing is around the triaging, where patients are required to fill in an online triage form in order to get an appointment. I'd like to find out how that's working, because only yesterday I dealt with one of my residents who's been going to her surgery since mid-January. She's even sat in the surgery for 3 hours and no one's bothered to make her an appointment. She keeps getting told, go away and fill in the online triage form. They won't do it over the phone, etc. So I'd like to know how that's working across Luton. What are the sort of complications or barriers that people are facing, and what are individual surgeries doing about it in terms of supporting their patients?
Yep. Okay. So we have an item, a primary care GP access item of the next meeting. So we'll make sure that both of those questions are put to the ICB representative at that meeting, and we'll let them know that they can expect those questions.
Yeah, specifically about the monitoring of how that is sort of being sort of provided across Luton, and what are the issues that surgeries or patients are facing. I mean, yeah, would like to know a bit more information around that.
If you want to put all of that information in an email and send it to myself and Nazat.
Yeah, that's fine.
And we'll make sure that the BLMK are aware of that for the next meeting. Okay, thank you.